So this is my first blog that I'm gonna do, and I've been meaning to do it for quite some time. I just didn't know how exactly to do it, but I've been in the healthcare industry for about 15 years. I work specifically in the administration side, so as far as like the medical billing. So we process claims for the insurance. We send out, the payment to the insurance after patients already have their services, and we check a lot of eligibility, patients' benefits, and yeah. So I worked out of the 15 years. I've worked at maybe 3 locations, maybe four location, and it's good to. I think it's good to have worked in these locations, and so the places that I've worked, um, they're big medical groups, hospitals, and at I worked at UCI Hospital, UCI of Irvine. I didn't work there very long. The other companies, I'll try to keep them anonymous. I I mean, they're very good companies. They have nothing bad to say. Um, but I was hoping to make this video, and I'm hoping that it brings value to people out there. My name is Jose, the benefit advisor, and I would like to. I talk about eligibility and benefits, and in that nature. One of the things that I always get when I speak to patients, a lot of patients don't understand why they're getting a copay, why they're getting a deductible. I pay a premium every month, and my first impression, or my first thought would be, when you work right, and you get insurance through your employer, and your workplace tells you, hey, the broker's coming for open enrollment. Go ahead and ask him any questions. And then us, as workers, we're like, oh, that's a waste of time. I got stuff to do. I got, that'll just back me up and whatnot. Well, I'm gonna advise you to ask as many questions as you can regarding the benefits that you're getting. So when you pick an insurance that you want, whatever your job offers, there's different tiers. You have your basic, you have your premium, you have your plus, and then you have your more advanced, right? And each tier costs so much. Now, if you're one of those type of people that don't really go to the doctor, don't visit the doctor as much, and but you want to get insurance just in case, I recommend the basic, in order for you to be comfortable. You pay less, you see the doctor very seldom, maybe once a year. You just see your PCB, go for a checkup, pay your copay, and that's it. You pay about 80, $90, whatever your premium may be, off of each check, and then it goes more as you as you would as you get whatever plan. If you go, if you're a person that needs to go to the doctor every so often, like once a week or something like that, you have, God bless you guys. out there that have cancer, that have any diseases, and they're going every once a week. They're getting chemo, they're getting MRIs, they're getting PET scans. It's they're going through the tribulations. They're going through they're going through it, and it's they those are the people that want to know their benefits. If you have any questions regarding your benefits, regarding any insurance, drop your comments below. I'll be more than happy to help you. I'll be I can answer any questions. Again, I'm not a guru at insurance. I know enough to give you your benefits, and call the insurances whether your exam needs an authorization. A lot of PPOs for high modalities, if we get in a big exam for PPOs, your insurance does require an authorization. So I would check with your insurance first. Check with the procedure. Check with the provider to see what CPT code they're doing. CPT code is the procedure code that they're gonna do for it pretty much it's the data service. Sorry, not the data service, it's the procedure code. So yeah, so there's a lot of things that has to do with insurance, and I want to be able to help patients to know more about their insurance. I know there's a lot of people out there, Spanish people. Yo hablo español. Mi nombre es José. Yo soy el Benefit Advisor aquí en YouTube. Y cualquier pregunta que puede tener sobre su seguranza privada, yo le puedo ayudar. Again, a lot of patients have that Medi-Cal card and they say they have Medi-Cal when really they have an HMO. Yeah, so there's a lot of things that patients, and I'm not sure if they're being educated enough to know how their insurance works. There's a lot of patients from LA Care Cover California. LA Care Cover California, if you look at their website, it is LA Care at a glance. So LA Care Cover California provides this wonderful grid. Excuse me. They provide this wonderful grid, and on that grid it shows what is the patient's deductible. For every plan they'll have a deductible. There'll be some insurances where they pay 80% or and the patient pays the 20%, so they have no deductibles, but they'll have an out of pocket. Excuse me. They'll have an out of pocket, and for every specific exam, they'll have it laid out so that you would understand how much you will pay. Now, the tricky part with LA Cover California is that, for example, you go in for an MRI. You get an MRI, and let's say your copay would be $325. And let's say you get an X-ray of the lumbar spine, your lower back. Now your copay for X-rays and ultrasound will fall on that same category. It would say 75 copay. So if you were to get an MRI, and an X-ray, you would probably be able, you would probably have to pay a copay for both. So it's not per data service, it's per procedure. So always check with your insurance. Check what is it that you're going to be responsible of. That way you won't get surprised and have to be able to pay something that you didn't expect. And yeah, so there's a lot of information out there. I do try to, you know, stay up to date with the insurance. I Google a lot, I research a lot. I try to see what is in compliance, so you know the operations is running correct, and and I and I'm able to talk to the patient, give them the information that they need, because it wasn't given to them. So I wish, or maybe this YouTube channel might help patients understand. Again, this is my first vlog. I'm just, you know, sharing some information, a little, you know, information of what I know. And I've been in the industry for about 15 years, and I really love what I do. And but I think is I would want to talk to the patient and show them the best option. Of course, you cannot hold a procedure when it comes to your life. If your doctor thinks that it's necessary for you to have it, and this procedure might save your life, by all means take it. Do whatever you have to in order for you to take that exam. If you don't have the money, borrow it. If you can't, if you don't have anyone to borrow it, ask for a loan. Use your HSA if you have it, if your job offers it. If your job offers HSA, use it. If there's credit cards that help patients, like care credit. I have care credit for my dogs. When one of my dogs got hurt and broke her leg, I didn't have the money. They were charging us they were charging us an outrageous number, 7,000 or something like that, for and 1,000 for an X-ray. I was like, whoa. Like, I work for this medical office, and we charge patients 75. You want to charge for a dog $1,000? That doesn't make sense. And then they actually lowered my bill. So my bill for the surgery, the prep, for the emergency, it was 700 in total. So I want to tell you one thing. So I went to the doctor. I was gonna have a colonoscopy, and before having the colonoscopy, I checked with the, you know, with the authorization. I called my insurance, and I tried to make sure that there was nothing for me to pay out of pocket. So colonoscopy, when you're at a certain age, it's a preventive, so you shouldn't be charged. So anyways, I go to the doctor, and I'm telling them I'm there for my appointment, and they wanted to charge me $275. And I told them no. Why am I going to pay $275? And the front office told me, well, because this is a diagnostic, and so we have to charge you. And oh, you know, you have a deductible, so we didn't realize that you had a deductible, so you might get charged more. And and I told them, based on the CPT code, based on the procedure, it's a preventive visit. You shouldn't charge me. And they didn't want to see me. They didn't want to take me. I called my insurance right away. This was during the week. I called my insurance and I told them what was happening. And they told me, well, what CPT code are they going to bill? And I told them the CPT code. And then they asked me, how are they billing the claim? And, stupid me didn't even dawn on me. And I asked them, because they were telling me, well, it's a facility. The insurances always get it wrong, or whatever. They always get it wrong. So we're billing this. And I asked them, are you billing it professional? Or are you billing it facility? And they told me, we're billing it professional. I go, then it's a preventive visit. Diagnosis is this, CPT code is this, and what you're billing, professional claim, it's a preventive visit, so I should not pay for anything. Now, if they were to find something and during my colonoscopy, and they have to go in further, then it would become a diagnostic. Then a copay will apply, which was $175 for diagnostic. And that would be separate from the colonoscopy, and it wouldn't be a preventive. The exam itself would be, but if they had found something in my colon, if I had colon cancer or whatever, again, my life is worth more than $175. I would be more than happy to pay the $175, but I didn't have to pay for it. So I was arguing the fact that I didn't need to pay. Anyways, well, I ended up getting the exam. I gave my phone to the front desk guy. He got the person's name. He got a reference number. It's always important that when you call your insurance, get the name of the person you spoke with, get the date, and then ask him for a reference number. If they do not provide a reference number, make sure that you do get the first name and the first initial of their last name. Medical offices don't ever release their full last name, so for security purposes. And yeah, so I would really like to make a podcast with any providers. So if any providers out there are listening to this, if you know a provider, forward this to them. And I want to make a podcast, and I want to hear about what do they practice, and I also want to hear about, has it been busy for them since COVID? I know a lot of practices have been really busy since COVID. They've been very busy, and there's just not enough doctors. But there's there's a lot of, if you try to call your doctor and your doctor doesn't pick up, or they do telehealth, that's because they have more patients than they had before. Myself, since COVID, I get paranoid for every little pain that I have. I was having some chest pains. I went to the doctor because I thought I was having a heart attack, and They did some MRI tests, they did x-rays, and they did blood work. They said everything's okay. You just had an inflammation in the area because of a broken bone I had. And I was like, oh my god, like I didn't even realize I had a broken bone. Like it was like over my head. And anyways, yeah. So it's been really crazy and overwhelming for a lot of staff and a lot of doctors. But if you're busy and your office is running good, um, hit me up on the comments, and I would like to do an interview with you. I would like to know, how's your staff running. I would like to know how are your patients reacting to the procedures, the treatments that you're doing to them, when their follow-ups. Are they being impatient? Are they being understanding? Stuff in that nature. There's nowadays there's just nobody has very much patience. They're always angry. They want everything like really fast, and you know we can only go so fast. We try to help them as much as we can. Doctors, providers, they try to help as much as they can, but it's just not fast enough. People want to, hurry up and get whatever procedure done, and they want to take that day and then that's it. But they don't have to. They don't understand the downtime. Some people have surgery. They want to be up the same day, and they want to go out and do whatever, do have a normal life. But when they barely have a surgery, they do have rest time. They do have to take care of themselves. They have to make sure the sutures don't open. They make sure if the staples don't pop out or whatnot. They don't start bleeding if they move around so much. They're active. They have to be settled. So I'm hoping that again, this is my first vlog that I'm doing, and I really want to be able to do a podcast with other providers out there and just ask them questions. People that are working in the medical field, you guys hit me up as well, and I'll be more than happy to do an interview with you guys, talking about patient satisfaction. I know that I had a few webinars with LA Care regarding patient satisfaction, taking a complaint to heart, and I'll share a video with you guys so you guys could see it if you're working in the medical field. It's I think right now it's a little tough. I think me, from doing claims and just pressing a button, making sure CPT codes and the diagnoses are correct. I think I developed a skill on talking to patients and making sure they're satisfied with the procedure, the way staff treated them, the way the doctors treated them. And I'll try to do follow-ups, to make sure they're okay. Call them before their procedure, and sometimes I would even talk to them through a procedure. And if there's a procedure that I don't know, then I'll get him on the phone to speak to someone that has a little bit more knowledge than me, and comfort the patient, have the treatment that they're there to get, and to make sure they're okay, leave home and good, and The report is then sent to their doctor, so their doctor can read it and go buy it and see what other treatments that the patient needs, or if it's a if there's really nothing, and just just patient is having some little pain. um, but I'm hoping to do more of these as time goes by. um, I do want to talk, because I have on my banner about mental health. It did affect me, the ending of 2023. It I guess from handling a lot of patient complaints and the way people treat you and they yell at you. And it's not so much just one or two patients that are just hounding on you, they're yelling at you, they're cussing at you, they're threatening you. You have to take all this and you have to try to be in a professional demeanor and respond to them in a professional way, so that the conversation doesn't go sideways. You always have to try to maintain professionalism and talk to them, so that they're later on regretting the way they're speaking to you, because you are just there for them. You're there to help them. You're there to inform them. And I've had patients like that I felt that I just couldn't handle it. And there's a couple of times, I think since 2020 and one in 2023, I've had, in those 3 years, I guess during COVID, I've had 3 panic attacks, and they were scary. So another reason why I'm doing this vlog is to hopefully help people. I did this hopefully can help somebody that is going through the depression is and needs to talk. I'll be more than happy to pick up the phone and speak with you. And again, I'm not a psychologist. I'm not a certified counselor. Again, I just work in administration. I've worked with a psychologist before, and so I know, the some of the paperwork that he would provide for his patients. Anyways, so I had a doctor from LA Care talk about, and mental health, and he would tell everybody during the webinar to if you're going through something, because everything was crazy, patients were just hounding on you, and you're human. You could take the beating so much, and sometimes you need to talk to other people, or you need someone to help you. At the time, I didn't have anybody to help me. I was the only one, and I sometimes didn't do my work because I stood on the phone getting yelled at all day long for 8 to 9 hours a day, and it was just crazy. Sometimes I would give patients my number, and then they would call me like early in the morning, they would call me late at night, and they would tell me, make sure this, make sure that, and I'm like, yes. And even on my days off, I try to help patients, and it was very hectic. Now it's not like that, but there are patients that do call, and they're very rude, and you try to understand why they're mad. What is the reason of them being upset? And you try to listen and try to pick up the signals to see why are they upset, why are they yelling at you, why are they cussing at you, and while you're trying to understand why they're yelling at you, you also try to understand what is it that they need, what is it that they're going through. And a lot of patients may not tell you, but there are some patients that they'll go off and they'll go off on you in a way where they would just talk about like their family, about stuff, and then in the end they'll say, you know what, thank you for listening to me, I don't want to file the complaint. And yeah, so it makes me feel really good just listening to them, helping them in every shape or form that I can do, that I can do my job, because that's what I'm there for. I'm there to help, and I love helping people. But the main thing is to educate people of their insurance, educate them on their benefits. You know, the premium is not the same as a copay deductible. Whenever again your employer is saying that it's open enrollment, go and ask the broker the tiers that you're picking. Also ask them if how much is your deductible. Now what they may not tell you is if something needs an authorization, if something may apply as a deductible. They're just there to tell you what is your deductible. Your deductible is $2,000, let's say, right? Or $1,500. You have to meet your deductible, and once you meet your deductible throughout the whole year, meaning from January to December, that's it, the whole calendar year, you'll have this deductible. And once you meet that deductible, then your insurance may pay 80% and you 20%, or whatever the benefits is from your insurance. If your insurance covers less, then you're responsible for more. And a lot of insurances right now, they're not paying as much as they used to before. They're making you responsible for the majority of the bill. So try to understand your benefits. Understand why you're getting a bill of $500. And if you happen to go to a hospital to get a certain procedure, when that procedure you could have done at an office, you could have been paying $300 to $500 at an office, but because you decided to go to a hospital and have that same procedure, now you're having to pay $10,000. A bill from a hospital to a doctor's office is different. A hospital bills hospital charges, meaning they'll charge you for your appointment, the doctor, they'll charge you for the room, the syringe, all the material that was used for that data service. If you go to a doctor's office, not your doctor's office, but if your doctor sends you to another facility, that place is going to charge you a global amount. So you, for the services that you could have had at the hospital, you'll be done there for, less the amount. So if you want to know the difference, and your doctor or yourself is wanting to know, next time you go to the doctor and they're telling you to go to the hospital, find out how much you're responsible for. Call the hospital, ask them how much do they bill, and call back your insurance, and then tell them, well, this is what I'm having, and this is the hospital charges, this is all the CPT codes that's going to be done for that day, what is my responsibility. And let's say they charge you your deductible, your full deductible of $1,500, but you have a co-insurance. You have an out-of-pocket, so you have a deductible and then you have an out-of-pocket. Your out-of-pocket is also your per calendar year. It could be 6,000, it could be 5,000, it could be a lot. So the insurance will pay 80%, and then you'll be responsible for 20%. So if you were to go to a hospital, they would charge you for your deductible. Then they would charge your co-insurance from your out-of-pocket. So that would be applied to your out-of-pocket. So you will get a pretty big bill at the end of the day. So I'm hoping this video, and as time goes, I'm gonna try to share more, maybe blog on how my day went, if I had a good day, if I had a bad day, and I'll explain what happened. Again, I can't go into too much details about it, but I'm hoping that I can try to help you guys understand your benefits, and be a little kinder to the people that work in the medical field. Again, not everybody knows what I know, and again, I'm not saying that I'm a guru at what I do. I still have a lot to learn, and I don't mind learning more. And a lot of the information that I'll be sharing, if you think that the information is not right, correct me if I'm wrong, and I try to make a video to correct it, because my intentions is not to put out there wrong information. My intentions is to try to help you and understand it. So again, my name is Jose, the benefit advisor, and my YouTube channel is to talk about the everyday challenges working at a office, understanding your eligibility and your benefits at your time of service, and see you guys on the next one. Bye for now.